March 3rd, 2009. This is a return visit for a 29-year-old man with pan-ulcerative colitis. Because of failure to respond to mesalamine medications and steroids, he was started on Remicade with an immediate and dramatic improvement. He received 2 infusions, is scheduled for another one in a week. After the first infusion, there was a dramatic improvement and things started to get a little worse a few days prior to his second infusion, which was at 2 weeks. He's now gone almost 6 weeks since the last treatment, and starting about 7 to 10 days ago, he noted that his bowel movements were softer, looser, more frequent, with some urgency, but no bleeding. He was having up to 6 to 7 bowel movements a day, and clearly the Remicade was starting to wear off. It sounds like Remicade is only partially successful. Lab studies have shown a dramatic improvement in regards to his hemoglobin and his C-reactive protein, which went from about 4-fold elevated to normal between mid-January and mid-February 2009. His hemoglobin went up to normal and his comprehensive panel was fairly normal. His transaminases have been elevated recently, but there was improvement with the ALT just barely above normal on the last measurement that was clearly better prior measurements. His liver tests have fluctuated, and initially, when I began seeing him, his transaminases, whatever the hell aminases that is, were normal, and between September and November, they were entirely normal, and the AST was in fact quite a low, between 9 and 14. Then in December, when he was feeling worse, they sprung up, and I suspected that this was either related to the medication or to his colitis. It could present early sclerosing chondritis, which occurs primarily in men with pancolitis, and the highest levels were in December, when his AST was up to 72, ALT was up to 112. I ain't sure what those things mean. The most recent assay done last month showed the ALT of 75 and the AST of 19. His weight is stable. He does not have any nocturnal bowel movements. I called him in to discuss trying to transition him to an immunomodulator such as 6-MP. I talked with him at length about the potential benefits of using this medication, primarily the oral use, which makes it less inconvenient and cumbersome to have infusions or shots. Also, the fact that it's been used for several decades and inflammatory bowel disease with about a 60% response rate. There's some initial side effects including nausea, chills, abdominal pain, headache, and rash that occur in less than 10% of patients. His usual dose for 6-MP would be about 100 milligrams a day, since he is about 160 pounds, and the dose is usually about 1.5 milligrams per kilogram. I've already checked his TPMT level to determine whether he would adequately metabolize the drug, and it is rather on the high side, which is sometimes associated with increased conversion of the drug to the metabolite 6-MMP, which can be associated with hepatotoxicity. He's about to go to Mexico with a bunch of friends, bachelor party, and he will wait until his return to start the medication. In the meantime, I recommend that he use loperamide 1 to 2 tablets twice daily to reduce the number of duty movements he's having, and also Canassa suppository at bedtime to reduce the inflammation in the rectum, which is a bit of a gatekeeper in terms of number of bowel movements, and may lessen the urgency and frequency of bowel movements. We will repeat his blood count today, along with a comprehensive panel, and I'll let him know how that goes. His prior studies were such that with the elevated liver enzymes, I was a bit reluctant to consider using mercaptopurine. The other concern about it is that it will take 2 to 4 months to have a full effect, sometimes up to 6 months, and previously we did not have the luxury of time because he was so symptomatic, and that is why the Remicade was used. I also talked with him about the fact that in some patients who do not respond to Remicade fully or start to lose their response, that Humira is an alternative, although it's not officially FDA approved for this, but it has been used off-label. It is approved for Crohn's disease. I also informed him that with 6-MP, we will need to monitor his blood tests more intensely early on to make sure he does not become neutropenic or have liver test abnormalities. I'll let him know the results of his lab tests, which we will do stat today, and then he will start on the 6-MP when he returns next week, and he will get another infusion of Remicade, and we will see how he does at that point. That's the end of the notes. It's extremely heavy, which to me makes me think it's got a lot of honey in it. I don't even know what to do here, but I know we gotta fix this problem.